Our next guest leads venture capital firm General Catalyst. He joins us now to talk about the big tech's relationship with D.C. as well as AI and healthcare. They just had a big announcement this week. Congratulations to you. I want to welcome General Catalyst CEO Hemant Taneja. Earlier this week, as we just mentioned, his firm and Amazon Web Services announcing a multi-year partnership under which General Catalyst portfolio companies will use AWS to help build and roll out AI tools for healthcare systems. And we welcome you and want to talk about that and so much more. But before we get there, just because we keep talking about Washington, D.C., this inauguration that's happening on Monday, I am curious about what you think is about to happen as it relates to the convergence of policy in Washington, this new administration, and big tech.
Yeah, good morning, and thanks for having me. Look, I think the mainstream adoption of technology is driving industry transformations now. And transformations inevitably require technology policy and capital to interoperate. So I think this relationship and what I would say sort of unprecedented level of collaboration around technology and policy is going to happen. Big tech is getting more and more sophisticated about dealing with DC. And frankly, our innovation ecosystem, our startup ecosystem is also realizing they need to be actively engaging with the policymakers.
And you've developed something, a global policy arm, effectively, the General Catalyst Institute. What is that aimed at doing?
Yeah, so we created the Institute to work with regulators. We're working with them in all the key markets that we invest in, DC, Brussels, Delhi, London. And the goal has been to work with them around designing policy for driving transformations. We have these two big themes that are driving innovation today. One is global resilience, which is all the nations are thinking about making core industries resilient. These are defense, energy, industrials, healthcare, manufacturing, you name it. And the second is the adoption of AI. So every country is thinking about how to be self-sufficient in these areas, and that requires technology and policymakers to work together.
How much of this is just a maturation? This is just a signal of where Silicon Valley is and its import in the economy today relative to maybe the way banks would have lobbied and spent a lot of time in Washington post-financial crisis, maybe before the financial crisis. You could have looked back at all the defense companies that obviously had a huge... How much should we think about it like that versus, and right now there's also lots of maybe skeptics or even cynics who say, oh my goodness, look at what's happening. All the big tech is going to Washington to bend, kiss the ring or bend the knee.
Look, I think when I think about technology, I think about innovation and adoption. So from an adoption perspective, as technology is going mainstream, this is becoming a more and more mature industry. But at the same time, you do have this applied AI trend where it's very unclear how technology is going to be used for this next level of transformation. So to that end, it's also very new. So I think you're dealing with, in some ways, as a cloud adoption gets accelerated and everybody is essentially digitizing all parts of the economy, that is becoming mature. But then we just got this curveball with Gen AI a couple of years ago where everything is going to change. And so from that perspective, there's a lot of new around, and you have to be careful about how you design policy to help accelerate that.
In terms of healthcare, because I know that's a big focus of yours, and AI, what are you seeing right now, and how quickly do you think that's going to develop? Is that the single industry you think that's going to have the greatest transformation over the next 5 years?
It is one of the industries that's adopting AI the fastest, which would be counterintuitive because you would think it's regulated, and this would be one of the slower industries to move and adopt AI, especially because it was one of the slower industries to adopt the cloud. But the need in this industry is so significant, especially after COVID, that a lot of the work we're doing, which we call health assurance, proactive, affordable, and accessible care, the only way to drive that is with technology. And so what we have seen through some of the companies we have either created or invested in, like Commure, AI Doc, and others, is that the health systems are rapidly piloting and adopting AI in all parts. This includes clinical AI, this includes tools to take the burden off of clinicians, care teams. And it also includes a lot of the administrative functions and how do you automate them with AI.
The holy grail, of course, is bending the cost curve. We've been talking about bending the cost curve for decades now, and we haven't yet managed to do it. Is this the moment that happens, or does it not happen? I mean, every time we talk about new technologies, we keep saying the technology is the thing that will bend the curve. Or do you think that there's something else at play?
I think it already is happening. I'm very confident that the next 5 to 7 years will see a clear blueprint for how we can change the cost structure of our healthcare economy. Otherwise, we're going to go bankrupt. Frankly, we don't have a choice. And if you think about the fact that the way we process payments in healthcare is going to be fully automated with AI. We have a company called Hippocratic AI that just launched successfully and is rolling out to many health systems this idea of an agentic nurse that is fully automated, empathetic, and very effective in taking care of the patients on the phone. When you start having these kinds of capabilities, you open up operating leverage in these systems that can be invested in the communities in a way that's much more affordable.
But here's the question: how are those products being priced? And the reason I ask is, what I think happens oftentimes with technology is you say to yourself, okay, a human costs X, and we'll call it $100 an hour. So we have an AI product or some form of a technology, and the good news is we can undercut them, but we're only going to we're going to charge $95. It's not like we're going to charge $5.
This is a very important point. This is the reason why in the last cycle of digitization, productivity did not get passed on to society because the tech companies captured most of it. I think this time around, a lot of the models and the innovation I'm seeing is about creating this notion of healthcare abundance. So if you could actually reduce the cost of a nurse on the phone using AI by 90%, and instead of that costing probably $90 an hour today, could cost $9 an hour, and over time maybe 90 cents an hour. How would you actually make these systems more profitable, make healthcare more profitable, but also start to think about healthcare abundance?
Right.
If the nurse is effectively free on the phone, how do you take care of your elderly and your other patients remotely in a much more effective way, in a much more abundant way? So I do think by bringing the cost curves rapidly down with AI, which is possible, we can actually rethink the care models themselves and keep the populations a lot healthier.